and said yes to the board, said yes to leadership. We knew Barry would be chair. Adrian and I were plotting behind the scenes, and we knew we'd break him down eventually. And each one of you, Bob stepping up, Jerry, we've really appreciated all of the work that you guys have done. Serving in this capacity opened my eyes to a lot. And I really value my 6 years. It feels like it's been 20, and at the same time, it's gone by so quickly. So I'll miss this. No, I won't, sorry. But I'll miss all of you, and I'll miss some of the discussion and some of the insight. I learned more about the city by serving on the board than I think I learned far more than I ever expected to. So thank you to all of you.
Thank you, Anne. Thank you, thank you, thank you. Okay, discussion item number 1, board application nominations. Barb Lee, are you still here? Can you zoom off for a moment? We need to maybe discuss and vote on you. So I'll email you when we're done voting on the nominees and you can come back in. So the executive committee interviewed 4 applicants, and there's 3 that we are putting forward to be approved. They are Barb Lee. I'll have a little bit to say about each one of them. Barb Lee has years of home health experience, which gives her unique insight into the financial struggles many face in staying housed and accessing healthcare. She knows the gaps in our social safety net. She's volunteered with Meals on Wheels, Second Harvest, and help with green space renovation. Yay, Barb. Karen Sabanakita has worked as an administrator in healthcare on the west side of the mountains. She's been in Spokane just a few years, but is involved in the Browns Addition Neighborhood Council, has volunteered at House of Charity, Lutheran Social Service, COPS, United Way. She brings an outsider's perspective, like someone from the west side, because she has been in Spokane a few years, but she's got that view of someone from outside. She has experience with RFPs and grant writing. David Lewis has 12 years experience as an employee of the CHHS department. He was instrumental in developing and setting up the HMIS database. He's very familiar with federal, state, and local programs we work with regularly. His expertise will be invaluable, especially in light of the department's turnover and loss of some of the institutional knowledge. So those are the 3 names that I am putting forward. Would anyone like to, so can I can nominate them? Okay, would anyone like to second that?
So you wouldn't do the motion. We might ask if anybody has any questions or comments, and then somebody can make a motion to put all 3 names forward unless we need for some reason to do it individually if questions come up.
All right. Questions, comments?
And if not, then I'll move all 3 names forward.
Thank you,
I'll
Adrian.
second that.
Thank you, Betsy. Any discussion? All in favor, say aye, raise your hand or wiggle your finger.
Aye.
Thank you. Any nays? Any abstentions? Oh, okay, there you go. Now, I'm not sure who, maybe, I don't know, Kim or Eric or Jen, but I think someone in staff now needs to put this before the mayor and ask her to say, yeah, and then send that on to the city council for them to approve it.
It generally comes from the director.
Yeah.
The director is the one that will forward it.
Okay.
And then it's to the discretion of the mayor first, if she chooses to do interviews or not. That's, it's been sort of hit or miss across. So some of us had interviews with the mayor, some of us didn't. But then those names that she moves forward go to city council afterwards. So those are the steps and why it takes a little bit of time.
Okay. And I know the mayor's busy, but Jen, can you use your enormous influence from your years of experience in the city to try to speed it up? I know for many of us, it took a number of months, whether it was David Condon or for me, it was Mayor Woodward. And I know it's a lot on her desk, but I would really like to get this committee beefed up and going. So whatever you can do, I'd be grateful for.
Jen, just so you know, it took us 6 months from the time that we went before the executive board until we were approved. So it does take a
Yeah.
while.
Importantly, not from when we submitted our application, but from our interview
Right.
to actually getting on the board. So
And just so everybody knows, we actually also, well, no, Adrian didn't. I did. I had to go before the city council, one of their work sessions, and got interviewed.
you're a lot more suspicious than me, Anne. So you know.
Maybe, maybe. I don't know
Okay.
what happened.
Anything else on nominees?
I would just say thank you for moving them forward, and we were excited with all three folks that came forward and bring really interesting perspectives. So we're looking forward and to be continued, because we're going to have some more spots, and we're going to be doing this process again in the very near future.
Yeah, I am planning at the next executive committee meeting to say, hey, let's open it up again, more people in, because we have open spots on the board. Anything else on nominations? Next item is conflict of interest policy. I'm going to table that because
We have to vote. Did we vote?
oh, yes, we did. We voted on the
We
nomination.
voted.
Yeah,
yeah.
they're in. They're nominated.
Did I
We're
vote
good
yes?
now.
You
Yes.
did vote yes.
Yes, we
I think
voted.
you even turned your camera back on.
You did vote, yes.
Yeah, right. Okay. I think I'm in another world. Goodbye.
You live in a good world, Ian. Conflict of interest policy, tabling that. I'm the one that's sort of investigating and trying to figure out what it is, where it came from, what it's good and bad. I'm still in the middle of that, so I'll just put that aside if that's okay, unless anyone has any questions about it.
The only thing I'll say is that the fourth person we interviewed was also a very interesting person, but is a conflicted person in that she's president, or it's just one of the service providers that we fund. So this is part
Yeah.
of why we're looking at the conflict of interest issues and trying to dig into the understanding of them and what they in fact do limit us to.
Yeah, that's what kind of prompted, at least for me, her application.
This is Gordon.
Mhm.
Before we move on from this, I just want to get a little advice and direction. So I've been interviewing people and just investigating to see who might generating some interest on to who wants to be on the board for workforce development. And so what do I do with this list I'm compiling? And how should I go about that? Is there going to be a cap as to how many people are going to be on this board? Or, is it going to all be full by the time I get around to, you know what I mean?
There's no cap on us. Our bylaws and ordinance do not cap us. That's a
Okay.
minimum of 12. So I think it's up to our discretion as to how big we want to get.
So based on where the board is now, as we're trying to build this new board kind of, should I slow down and just kind of take my time, pace myself and just try to compile a really good list, because I'm checking with the community too, what's going on in the community and who might want to be on this board and what advantages it to them, and stuff.
My recommendation, Gordon, is I would like to move quickly myself. So I do not encourage you to slow down. I encourage you to move ahead. And if you have individual questions about like, will this person fit with the conflict policy? I'm getting pretty proficient with it. You can just run them by me.
Okay, so I'll just, that's what I'll do. I'll be talking to you.
Okay, thank you very much. Anything else on conflict of interest? Okay, then number 3, Liberty Park, Betts, Jefferson, George, what's our action on that? What do we need to do?
Yeah,
Oh.
So the Affordable Housing Committee met on February 8th to review a few projects. The first one is Liberty Park Terrace. So what we were looking to do is increase the funding allocation for that particular activity up to $1.1 million. Or sorry, I've got $1.3 million, or the HUD maximum allowable allocation per unit. So the hiccup with this project is they had applied for some additional funding through the state. They did not get that. And so now they're looking to go a little deeper on their home allocations. So that was approved by the committee to proceed in that way. The next project was Vets on Lacey. So this is a project that had already been funded by the board. And the action here was that the county wants to be a partner on this project as well. So the board had originally approved 10 units. And we want to dial that back to 8 units so the county can buy 2 of those units with their home funds. And then to increase the allocation by $200,000 for those 8 units as the construction costs and everything have gone up. So that was the recommendation of the committee for Vets on Lacey. And then for SNAP Resident Court, this is a little more house cleaning. So there's around $50,000 remaining on an existing contract. So it was just renewing that contract so that SNAP could finish that work. It got delayed as part of kind of the COVID situation unfolded. And then lastly, I don't think this was on the agenda, but we discussed RIDPath. So the owners of the RIDPath are going back. They're looking at a refinance through one of HUD's programs, and this is actually a really good thing. It allows us to maintain a really strong position in our contributions to this project. So the action was to maintain our subordination position within that project as it exists as they go through this refinance proposal with HUD. So those were the actions that were taken. Adrian, I don't know if you had anything else or anyone else that sits on the Affordable Housing Committee that you wanted to add to that.
George,
I would just say, oh, yeah, I would just say
and
that
Jefferson.
Betsy, what's your question?
Well, on here, there's one 5th and Jefferson. What is that project? Or we're not talking about it?
No, it is. Sorry, that is SNAP Resident Court.
That isn't
So-
that one. Okay, thanks.
Different legacy
Yeah.
names of projects over the years.
Yeah. So I would say that just as far as the flavor of the conversation for the Affordable Housing Committee was pretty enthusiastic support for things that were ready to go, but needed that last little bit of funding, and so us revisiting and being able to fill in some of those gaps was moving that forward. So there wasn't. I will say the debate was, how much can we give more than trying to limit, because we have some funding that, because of COVID and extensions and things like that, we've got some funds that haven't been encumbered by some timeliness things, and so we have some sort of buildup in some things, such that this doesn't none of these pieces really infringe on our normal cycle of funding and those sorts of things, and they're able to get off the ground, so get those units made available. The SNAP SNAP project it's again just an extension. We had asked, there were some repairs that we had expected, and then for various reasons, between COVID, between staffing and other sorts of things, that didn't get followed up on, but those repairs still need to be made, and SNAP still intends to make those. So that is just giving them an extension to make sure that that gets done in the next few months. And then as Paul was saying, the RIDPath piece is that refinance, and that was one that since we're not giving funding for, we were just approving their process for refinancing and where our position on our loan to them would fall in the order of those kinds of debts, and that refinance was always the intention, because that will reduce their interest and free up some other money to do things. And so that again was just sort of an approval that we did in case it was needed, more than because we knew it was needed.
So are we ready to make a motion to approve those items? Anyone want to do that?
Make a motion to approve the items as presented.
Thank you,
Liberty
Betsy.
Park, Betson, Lacey, and Fifth and Jefferson.
I'll second.
Thank you. We have a motion, a second. Any discussion? All those in favor, raise your hand, wiggle your fingers, say aye.
Aye.
Any opposed? Any abstain? Motion passes. Thank you very much. Thank you, George. Good stuff. RF committee nominations and approval. Jerry, do you have that you can put for us?
So what I can say is that our RFP committee, it needs to consist of at least 2 active board members with Anne rolling off. Currently those 2 active board members are myself and Anne. And then we've got also a committee of non-board members who are just fantastic. Anne's rolling off the board, so now she's just going to be a committee member at large, a community member. And so we need at least 1 other board member to join the RFP committee. And it's a really dynamic committee. So in my time, Anne can speak to the legacy of it. Over my time, which has been short, we have focused on reviewing applications related to COVID relief rental assistance and helping support the city and the community in that way. And that's been really dynamic and a really rewarding experience. This is the committee that also oversees the RFP process and evaluation of the 5-year grant process. I have not had any experience with that so far, so I can't speak to it. Anne could probably speak a little bit more to that. But so actually, Anne, I do want to turn to you. I want to pitch this committee, and then what I need is somebody. I need if anybody's interested to kind of volunteer, and we can nominate you to be part of this committee, the RFP committee. We also do have potentially new board members coming on, but we know that process can take a long time. So we are asking that current board members, if anybody is interested, to please step up and join this committee. But Anne, could you speak to all of the great things that this committee does?
Yeah, I think you learn a lot about the city when you're working on the RFP committee. Being able to review applications, looking at one of the things, George, one of these days, we'll be able to look at the performance and review that. And I think maybe in 2 years, is it really only 2 years? The 5-year apps will be up, and we'll be starting to look at the new ones. So it's quite a process. It's really valuable. We don't meet on a regular basis. We meet as needed. We were going to have quarterly meetings for sure, but then COVID struck, and I think we had one, and that was it. But I think you learn a lot, and it's really a valuable contribution to the community. We sit and discuss all the applications that we get, and are very thoughtful and non-conflicted, and it's a great opportunity.
Thanks, Anne. And I do also want to mention that that this second, since again, we currently only have 1 and I'm serving as the chair, the second board member that will be joining will kind of automatically be our vice chair for the committee. So that's just another thing, which is not a whole lot of effort or responsibility on that part, but I do want to make sure that that's known. So I guess, Barry, I'm going to turn it over to you. I guess we're looking for people who are interested in serving.
All righty, I am going to put you on the spot, folks. Here we go. Anyone in this room would like to nominate themselves to be on the RFP committee, because when Anne leaves next month, we are down to 1 and we need 2. Anybody want to put themselves in the pool? Jen, this is why I really ask you to push the nominations to the mayor, because of the 3 people, 2 of them who we sent on to you specifically said to me they would love to be on the RFP committee. So I am very grateful that actually no one did speak up. I mean, I wish somebody did. Of course, I wish somebody did. But I'm also very pleased that this is something Jen can take to the mayor, because we have people who want to be on this board, who want to be on the RFP committee, who would be really good on it. So I think at the moment, I think we just have to pass by this item and table it and come back to it next month. Is that what I would
The
do?
only thing I would say is we do annually approve both of the committees with their current membership. So we might go ahead and do that just to do that official approval. And then if other people volunteer or we add to that, we could do that when that happens.
We'll do that. Would someone like to make a motion to approve our current makeup of the RFP evaluation committee?
Also move.
Thank you.
I'll second.
Thank you. Second. Any discussion? If you're in favor of it, wiggle your fingers, raise your hand, say aye.
Aye.
Any opposed? No? Any abstention? Okay, motion passes. Thank you very much, Jerry. Adrian, same thing for Affordable Housing Committee.
Yeah, so well, for anyone who's new and wondering why it is that Anne is stepping away and I'm not, technically both of us are terming off. I've been allowed to stay on especially as the immediate past chair for to help with the continuation of the board. But that said, I am the current chair of the Affordable Housing Committee, and although I would plan to continue to serve once I term off, I can't. According to the bylaws, I cannot serve as chair of that. And I have been in the position that Barry is currently in, where I was both the chair of the board and the chair of the Affordable Housing Committee. Not a good combination. That's a lot and not recommended. So I have the same request of board members to consider serving on the Affordable Housing Committee. I will say that it's, well, not to put too good of a plug in, but it is a lighter chair load than the RFP committee. I will say that for certain. But I just want to make that request. But in lieu of folks having the capacity to step into that position, or until we have more board members who are able to step into that position, I would like to go ahead and reaffirm the committee as is, as we currently have represented. That's on the second page of your agenda if you're looking for the members of the different committees.
We currently have 3, Adrian, myself, and Gordon. Any discussion on that? Someone like to nominate affirming the current membership?
Also move.
Thank you, so moved.
I'll second.
Thank you, second. Any discussion? Those in favor, raise hands, say aye.
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 You're opposed, say nay, or thumbs down. If you'd like to abstain, let me know. Nope. Okay, thank you. That is approved. Thank you very much. Bylaws, Jerry. You get double duty today.
Yes, and happy to do it. And I just had them pulled up. Let's see here. So I can pull them up here and walk through it depending on how much time we have, but let me just start by talking about what happened. So we do, we have historically done a revision and confirmation of the bylaws every 2 years. We're a little bit off of that schedule at this point, just COVID and all that madness, plus new board members. But we are at that point. So a few months ago, we appointed an ad hoc bylaws committee, which was myself, Anne, and Jason McAllister. And we've gone through the bylaws and made some changes, which have been sent out to you. I want to start by saying that there's really nothing super provocative about any of the changes that we have made. We really were looking at the bylaws and looking at the ordinance and really focused on just aligning these two things. Because we really wanted to be able to call to the ordinance as our establishing documents, kind of the source of our authority, and making sure that our bylaws really are reflective of that. So we went through and kind of took out the language that was in purpose, powers and duties, active membership, and inserted the language from the ordinance. It seems like really big changes, but actually the meaning is not really changed. It's just kind of sentence structure and the language. So we really just have that exact language from the ordinance now in the bylaws. However, we did go through all of these sections and make sure to include things that really reference our HUD mandate, but that were not in the previous bylaws. Or had been added in later. So we really make sure that's another source of kind of where we draw our authority and what we're accountable to. So we wanted to make sure that our bylaws were reflective of that HUD mandate. We made sure to add back in places that really assert the board's commitment to diversity and equity. And we added in things that really reflect contemporary practices of the board. So Barry, tell me, is it helpful if I pull this up and kind of walk through it? Or I don't know what we have time for. People might have read this ahead of time.
I think I'm going to ask if anyone is interested in that. I mean, I've read them and I saw nothing provocative. Exactly what you're saying is what I saw. So at least for my benefit, I don't need to go through it. But is there someone in the room who would like Jerry to go through it?
Or are there specific questions about the bylaws?
Yes.
Yeah, or do you have,
And go ahead, Adrian.
I was just going to suggest, just for the good of this being a public meeting, not going through the things that were just sort of aligning language with the ordinance and whatnot, but maybe some of the inclusions of some of the diversity and equity lens that's sort of new to the bylaws might be a helpful thing for us to share in the public meeting format.
Okay, perfect. And I thought it would be really easy for me to pull this up, but I don't typically use WebEx. So I'm wondering if maybe Kim, you have, or somebody else can pull those up.
I can do it.
It's attached to the agenda with all of the markings. Also note, in addition to the bylaws, I hope are included in this is the committee governance. And that also is a document that are attached to the bylaws. So when you approve the bylaws, you're also approving the committee structure and governance.
Yes, and we'll go through that. And I should have opened this to you earlier, but we'll make sure to finish with your input as well, especially with your 6 years of experience. It was also really important for us to get to this and finalize it, because this was Anne's last meeting and because we did not want to lose her insight and experience to this process, because she's gone through this revisioning process a few times. So Anne, I'm going to go through this and I'm going to hand it over to you as well. So these first few sections, you can see where we're kind of just crossing out and adding that other language. Barry, could you slowly scroll? And I'll tell you when to stop. Some of the important parts.
As you're doing that, let me just say for board members, very specific guidelines in there, what you're held accountable to, what your membership is. If you're going to be absent, you need to notify somebody. If you need to take a leave of absence, it's all laid out in the bylaws. So you really need to know those bylaws.
Mm-hmm. And this is the section that is getting to that point. So Barry, could you scroll up just a little bit more?
Sure.
So here is the section, that Anne's talking about, that talks about what our board membership is going to look like, and if there's vacancies on the board, the process that we will undertake to nominate new board members. There's some language around how we're going to coordinate with the continuum of care. And that language actually needs to be changed now. I'm looking at it. And then down here, yep, this is it. Here it is. So here's the part that we added back in on this number 9. The board will strive to include representatives from LGBTQIA to S communities, communities of color, indigenous communities, and peoples with the experience of low income and or homelessness. So this is one of the places where we really want to make sure that we are being inclusive of really the many different communities that represent our city in Spokane. Let's see here. That all looks good. Yep, some language around officers and you might have just said this, but there is also the expectation that board members are attending meetings, that we're recording your attendance, and in the case of so many absences, the executive committee will review that. Although leave can be and will be evaluated and is something that's possible. Perfect. Here is the sections that are in reference to the 2 different committees here. So we start with Affordable Housing Committee, and here's the language that we added to both Affordable Housing and RFP Committee that just reflects our common practices. So the chair of these committees is going to report activities to the board at the meetings and work with the executive committee to add any action items. Let's see here. There was some language. There's some language that needed to be cleared up under affordable housing that aligned with our conflict of interest policy versus previous practice of a recusal. And that was for Affordable Housing Committee. For the RFP Committee, language that we added was around the creation of an agenda, and that agenda will either be verbal or written, and that we're making sure that those committee members are getting communication before each meeting so they know what they're walking into. And then just language around how we need to have at least 2 members from the board active on those committees to ensure we've got a chair and a vice chair, and that the committee sizes, I think, are both set at 12 members each with no more than 50%. We won't have membership of board members that's more than 50% of our total board membership. So meaning that we're not trying, we can't have the situation where we turn those committee meetings into public meetings. So if we have 50% of our board members present at a committee meeting, that's quorum, and then it becomes a public meeting. So we limit to that. So we have to have less than 50% board membership on those committees. I think those are some of the main things. Go ahead,
Yeah.
Ann.
I was going to say, yeah, you have to have less than the membership, but if people don't show up, so we had many meetings with the RFP committee where not everybody would show up. So one of us on the board would have to agree to leave the meeting because we had made it in attendance. It's just not the membership. So you have to make sure and I know you guys right now, that's not an issue, but it might be someday where you have too many board.
Mm-hmm. The other piece, I think Ann might have froze there. The other piece of this that looks like a lot of editing was happening right where you're at, Barry, is for the RFP committee. So we have our standing membership of the committee, which meets every so often and does these these review processes that come up. But we also, and this is the part that I have not experienced yet, but we also need to have a pool of review candidates in place that can be called upon, particularly when we do the 5-year grant reviews, because those are big and it takes really a lot of effort and energy. And so we like to have the opportunity to have a pool of experienced candidates who have that kind of relevant expertise, but are non-conflicted, who we can call upon to serve as reviewers. And so as far as I know, we don't have this kind of standing list available to us. So I think we'll need to build that. I know that we probably can look back at who served in the past, but that's something that our RFP committee will need to be doing at some point, I assume, in the next few years when we get ready for that process.
And
And
I'll
what
also
else?
say, Jerry, I'll also say with that, the expectation when the 5-year comes around, if we do the same process, is that all of the board members serve on some committee that's reviewing. So things get broken up into things like workforce development or different categories of things. And then the expectation at that time would be that board members who don't serve on the RFP committee would still participate in those subcommittees evaluating those RFPs as part of your list that you'll have.
Perfect. That is great. That's great insight and information to have. So get ready, people. Anne, would you add anything else?
Mute, Anne.
Thank you. Okay, well, that's the end of my sentence. No, make sure that any changes that you make to the bylaws in the future have to agree with the ordinance. And you can always go in and change the ordinance, but I don't advise it. Because once you open up the ordinance, then it's open to the public. And so any changes that you go in and say, well, we want to do this differently, let's change the ordinance. Then you have city council, you have the mayor, you have the public coming in making changes, and you don't know which way they're going to go. Didn't always go the way we wanted. We got into an ordinance change, so I don't recommend it, but you may have to at some point. Those are those are my final words of wisdom. Don't change the ordinance.
That's helpful, Anne. Thank you. Betsy, I see you have your hand up.
Yes, so I just want to say, Jerry, that in this ARPA process, we are gathering names of community members to help us on our RFP process. So once we have captured that, I will share it with CHHS, because it wouldn't make sense for us to be trying to capture some of the same community members and doing double duty work on that. So I'll keep that top of mind when we get there.
Yeah, absolutely, Betsy. That'd be wonderful. And if you feel so needed to call out to the RFP committee to help in that process, we are here as well. I mean, when we did the rental assistance, that wasn't something that it didn't exist before. So it wasn't something that had been part of what the RFP committee did, but we were called upon, and I think that went really well. So if you do need further assistance, feel free to call on us for that.
And I think with Mr. Finch's idea, a lot around housing, that there will be a lot more work coming to this RFP committee. So you'll look at him grinning. Need to build out our bandwidth in order to get that work done.
Okay, great. That sounds really good. And did I just see that you just had your hand up again?
Oh, no, I'm willing to help out with the RFP committee with city council. I know. And
I do want to, I do want to say one thing about just because I think that sometimes there's confusion when we're throwing out these committee names. The RFP committee is focused primarily on services funding. The Affordable Housing Committee is also an RFP committee. It's just looking at capital projects and the capital funding. So that's kind of the way that those have been divided up. And so as you're thinking and also looking for folks, Betsy, I think other people volunteered to also be engaged in that process. But the Affordable Housing Committee is also a space of non-conflicted people that could also participate depending on some of what you end up for the proposals you end up requesting.
Thank you, Anne.
Yeah, and that's why I agree too that the RFP committee would be potentially a good fit without me knowing much about the ARPA process you guys are undergoing, but that we might be able to serve in that way as well with that social service focus. So I'm not sure the next steps of this. I know Anne and Adrian know, but I'm assuming somebody's going to go through and make all those changes, so clean up the document and then send it on to council. The one request I have, as I was just looking through that, I noticed there was a typo. It's on continuum of care. It said coordination of care. So I don't know if that's Kim or whoever is doing this. Could somebody just make that change instead of coordination of care, continuum of care? Make sure that that's.
Yeah, I can get that.
Okay, thank
did
you.
we already approved the changes? Did I miss that one again?
No.
Okay, so I move that we approve the bylaws as amended with the correction in place.
Betsy, you got your hand up.
And can I make a friendly amendment to that? I think it would behoove us to send it to Brian McClatchy, the council attorney, to let him go through this. That way we can make sure it's in line with the ordinance and everything else before we vote on it. So you can shoot it, well, I'll get it to Mr. McClatchy and have him take a look at it and then get it back to you, Jerry, or whomever, so we can have that done. Then at that point, it should be smooth sailing.
Yeah,
Okay.
and I was trying to remember because I feel like that is what I don't know it was the council's attorney, but I know that we did we like this step would be approving it as we've pulled together, approving it to send to legal, I think,
Right.
is what we normally do next.
Right.
Yeah, that's what we did last time is we
Yeah.
approved, we said we like it. Then it
Okay.
goes on to council, to the attorney, city attorney.
Yeah, the
looks it
city
over,
attorney.
Okay.
make sure we're within the ordinance, that everything's kosher, and then sends it back or sends it on.
Yeah, if there's
Unless there's
changes,
no
yeah, if there's
changes.
changes, it comes back to the board so we
Yeah.
can approve the changes. If there
Yeah.
aren't changes, our motion would be to approve it as is, to go to legal, and if there are no changes, that it goes on to city council.
So I'll gladly kick it to Jen and Eric to figure that out, and then they could let us know.
So do we have a motion, what Adrian just said, to approve it as is, to move it on?
So move approval.
Thank you. Second?
I'll second.
Thank you. Second? Any discussion? Wave your hand, say aye, or something.
Aye.
Aye.
I,
You. Any nays? Any abstentions? Thank you. Passed. All right, that's it for the discussion. Now we move on to the director's report. Jen.
Okay, hello everyone. So the first item we had on the director's report is the COC retreat overview. I think a couple of you actually attended, and it was a really good experience. There was, I think we had over 50 folks attend, and there was a review of the coordinated entry process, which I think was illuminating for a lot of people in terms of kind of discussing how people get into the pools to access services through that process. And then we went through an additional kind of exercise where we, Eric actually took us through some of the items that he shared with this group as well in terms of going through kind of that system mapping concept. And then we went around and did some breakout sessions where groups were able to take a look at, different kind of subsets of issues, and then provide some feedbacks on gaps and strategies, with the idea that this will inform our 5-year strategy going forward. There has been a draft of a planning process that has come out that is still being finalized, but essentially with support of the Empire Health Foundation, kind of hired a facilitator and some additional help that they would kind of take us through a track of an 8-week process to kind of identify, use all the information that we had to identify needs, and then create a strategy through that. So does anybody have any questions about that?
I would just say that I'm going to introduce the brief draft in my part later on, and also 2 things. This is so the Continuum of Care Board is a regional board, and they need to revisit this 5-year plan annually and make changes and make shifts. And the goal is to make sort of some robust shifts and get more buy-in from the entire community, including the other boards. So my request when we get to that part is I'm going to be sharing some of the working groups and provide the opportunity for people during this meeting or between this meeting and the next time the COC is working together to offer to participate, because the hope is that there is robust board involvement in these different working groups so that we can have a more holistic plan and that all the boards are kind of on the same page going forward.
Great. Thank you, Adrienne. I'm glad that you'll be reviewing that. Does anybody have any questions before I move on to our next topic? Doesn't look like it. Okay. So the next item is the COVID-19 Rental Assistance Fund. And as you know, we have fully essentially spent out, or at least promised the majority of the, or not the majority, all of the rental assistance funds that we currently have available to us. We have been notified of an additional contract from Department of Commerce for COVID-based rental assistance, which would be an ERAP 2. And we're expecting a contract of approximately 5.8 million total. And really the eligibility of applicants and allowable expenses are very similar to previous funds. I don't know how many of you know this, but Kelsey, who is managing this, has left the CHHS department. So we are down an employee in that area. I spent the last week, 2 weeks almost, kind of training with her on what she has been doing. And luckily, it happened in a lull, I suppose, where we've really spent out funds and we're waiting for new funds. But she did send out this information, and she recommended that we get a meeting with the RFP and review committee as soon as possible to review current subgrantee performance and to generate a formal recommendation of how to award these ERAP 2 funds. We had used this method several times for previous tranches, which helps us ensure that these funds are quickly distributed to current partners who can keep their programs open, rather than opening it up to new programs to develop and deploy funds. So that is where we are at with that. I'm hoping to kind of pull some items together and then reach out to the RFP committee and the review committee, RFP and review committee here soon. Does anybody have any questions on that?
I guess I kind of have a question about
Sure.
that. It's not specifically about that funding, but I wonder if this has caused us, the CHHS department, or maybe beyond that, to think about additional rental assistance funding in general. I know we have some rental assistance funding, but this has been such a program that's clearly been needed, and we've got way more need than we have funding. And so I'm just curious if there's any intention to investigate other funding sources to continue a program like this beyond those federal funds.
I mean, absolutely. I think that that obviously, as you mentioned, the rental assistance has been hugely beneficial. We don't currently have the bandwidth around looking for additional funding in this moment, but as soon as we do, I mean, one of our goals would be continuing to enhance the breadth of the funds that we have available to distribute. There's also opportunities really with existing funds that are eligible to be used for rent assistance, right? So if you look at some of the funds coming through the federal government and in other areas, some of those do have rental assistance as an eligible expenditure. So, how do we, if that's something that's important, how do we make sure that those groups know who are making decisions about those priorities, how important rental assistance is, and that should also be a priority in our community.
Yeah. And one thing I just want to say also, in the work that the RFP committee was doing with Kelsey, she had talked about participating on a statewide task force that was looking at this exact thing of creating a permanent fund. And with Kelsey leaving, I'm not sure if there's, the person who might fill that space will be continuing on that task force, or if there's any other representation. So I don't know, Jen or Eric, if you might be able to speak to that.
Yeah, so in the interim, I'll be taking over all of those tasks. This is not necessarily on my list, but we did have interviews for a program manager role last week and the week prior, and we're hoping to make an offer for someone this week. So that would sort of fall probably into their wheelhouse at that point in time. And then we're also posted to fill the vacant position left by Kelsey as well. So in the interim, I will be holding on to all of those pieces until we have somebody to hand them off to. Okay, great. Next up is the point in time count. And we had a really great point in time count so far. It's still in progress. The sheltered count is still happening, but we had it was a 6-day point in time. It ended on Tuesday in conjunction with the community-led Homeless Connect at the Spokane Convention Center. We had 140 volunteers. We had nonprofits, providers, partners, and others who really did a lot of work to get out and count our folks to make sure that we're getting an accurate vision of how many people that we need to be working to serve. And Eric, I don't know if you have and I know none of these numbers are formalized, and I don't know that we want to share them in this venue, but I didn't know if you wanted to speak to that.
Yeah, so I think it's not surprising. I think, I mean, again, we're still in the, I think they just finished yesterday. Obviously, we gave the team, a day or so off, even though they still came in the office, to do things. So it'll take us, I think, a week and a half to put the numbers, but I think we saw an unsheltered number that was kind of like in the 800 range. That kind of serves as about maybe a 15 to 20% increase over what we saw in 2020. But quite frankly, I was expecting more closer to a 25%. I think that there's still a lot of devil in the details in terms of how we look at those numbers. And I think look at them both, in terms of, you and, the questions that were asked. So, but, I think one of my takeaways, just as I did, I spent about 3 days, as part of the teams doing the counts, was I was surprised, and you might all know this, but, I remember I'm a little bit newer to the community here in terms of the homelessness and housing problem. But I was surprised at the large number of people living in their vehicles. And so, I think there's just certain areas like that that I think we need to take on board. We have to have those discrete counts. Not that there's anything perfect about them, but I think it helps us align policy and strategy and programs, to help, I think get after those. I think there's also, I think a broad difference in terms of behaviors, right? I would also say that I think the behavioral health piece and the substance abuse piece, I think demonstrated through the questions that these folks were answering themselves, points to, as we, I think, have been long assessing a large scale need in those areas that surpasses our local capability to serve. And so I think those will become areas that I think as we go through this, the seniors is another, grouping that we saw that we're just going to have to, I think, use these numbers to help us tell the story and look at how we would handle those gaps, because in some ways I think those are different solution paths than potentially the rest of our programs are oriented towards. So I think that's the best summary I can kind of get.
Great. Thank you so much, Eric. Does anybody have any comments or questions on the point in time count?
I was just going to offer one little bit of context, and again, because Eric and Jen are both new to this, we never get the official report or official numbers for a couple of months. We just sort of check in so that we're sure that we know the timing, because one of the things that we do as the board representing various folks is that we like to be informed to be able to answer questions to people. So to be able to say, yes, the point in time count happened. It just wrapped up. It's going to take, 6 weeks before there's a formal report out with those formal numbers. Those are the kinds of things that we just need to be reminded of so that we're able to share that information and not be another place going, I don't know what's going on, right? I mean, because we do know. So please think about us as how can we help message as well.
Yeah, and I appreciate that, Adrienne, because again, part of what at least I've committed to is within 2 weeks, just giving some raw information. And then in that 2-month period, like you talk about, then the fuller report. But I do want to take a little bit of the energy. I mean, it's just a count, folks. I mean, it's just a survey, right? There's nothing magic about it. And I think that the other takeaway that I would offer is that this is the first time, as I understand it, that we've done it with the level of volunteerism that we had. I mean, a lot of it has been internal or service providers or leveraging, I mean, I think, existing, case managers and workers that are out there in the trade. And one of the interesting aspects of this with the volunteers that we had, and a lot of them are, from the Homeless Coalition and other, groups that are actively interested in this process. It was educational. They got matched with other people that were in the service provider or agency type mode. And so there was great crosstalk and education that went on. And I think that was helpful, because I think sometimes the more people understand about a problem, the more we kind of come together and align on a problem versus just, take our polarized view, right? That is a little bit easier when you're sitting on your sofa in your warm house with, your bowl of ice cream.
And that context is also important, and that's why we keep putting it on our agenda, even though we don't directly work mostly with folks that are experiencing homelessness, is just that reminder of what the value is of the point in time count and why it's just a piece of the puzzle. So it helps all of us to be reminded of that, and for that to be shared in a public meeting so that we can make sure we're helping to contextualize that as well.
And to connect this, I think, to the future planning piece that Jen mentioned, one of the catalysts for this is that once we kind of do this data, packaging it a little bit with economic data and what we've seen in COVID and housing information, and then we want to give this to these various groups that are being discussed as part of the CHHS, CHCBD. Sorry, Kathleen, I always get yours wrong. I've heard it like 10 times and I still can't get it right. But COC or otherwise, where we empower groups to take the numbers and do the deeper dive on them. Because I want it also not to be a CHHS staff thing, right? I want it to be a community informed, and where we're asking that group to come back with a set of planning numbers, like a range. Hey, we think for this category, having looked at the information in detail, we think for behavioral health, you need to do, between this number and that number. Because I think if that's more of a community informed, and deeper dive conversation, then that's going to be a better way to plan than just one point in time count number.
And I would just mention that we are always really interested in the point in time count and review it, and have reviewed it, at least for me, for the last 5 years as I've been in this administrative role. And always find it very interesting that some of the correlations that we see on the behavioral health side, especially with Eastern State Hospital, and a lot of people coming into the Spokane area because this is the medical hub. This is also the behavioral health hub for Eastern Washington. So they are coming into this area and staying in this area because there are services here. At the same time, as we have observed, there has been a workforce shortage for behavioral health professionals for several years. The pandemic has made it much, much worse, as everybody knows. And so what we are aware that there are gaps, but I think it's much different than a lot of people think. It's because integrated managed care that came in to our region at the beginning of 2019 changed the entire structure of behavioral health services in our in Spokane County, as well as the 6-county region, which was an 8-county region at the time it changed. We had 8 counties. And what changed is managed care organizations took over all of the Medicaid contracts and funding, and they subcontract to the contractors, same subcontractors we did when we had all of the Medicaid funding. But all that Medicaid funding left our department and went to all the managed care organizations. So, and the idea behind it was trying to make people healthier and have a better quality of life by having their physical health and their behavioral health needs met by the same providers or provider system network. And so, but with that, a lot of things have changed, and a lot of gaps may exist that we're blind to seeing because it may be on the Medicaid side. And with the non-Medicaid eligible individuals, which have to be at or below the 220% federal poverty level, we are given funding, but not sufficient. And in fact, our contracts actually read we provide services within available resources. So the state actually recognizes that we don't have enough funding. So we basically put out what we can to manage within those available resources. And so that is obvious natural gap that all we can do is continue to put out as much as we can and work with the legislators and others to increase funding, which we are. I sent an email today to all the senators to increase the budget based on the House's increase in budget funding for behavioral health services. So we have a lot of mix of challenges that we're constantly trying to address the needs, but we have a lot of rules. We can't cover this, we can't cover that, we can't cover this, because we are not supposed to be providing Medicaid funds, funding, serve Medicaid individuals except for crisis services. That's where, because we're also over the crisis system. So it's always been kind of a very complicated, cobbled together system by different sources of funding. And now it's even more so because we have so many funders in the system with regards to putting out funding to all the providers. And the providers are struggling because of workforce shortages and and the rates have always been too low. And people are leaving and going into private practice and don't want to be in the public system because of the lack of good salaries and retention, and it's because the rates are so low for our providers. So we have a real challenging system to work towards. So we are always working and looking at the gaps. So that's why we find the point in time count very valuable. And so I just thought it might be helpful for some people who might not be as familiar with the behavioral health system, the community-based behavioral health system in the area, and recent changes to it, and why it's quite different than it was a few years ago. And so we're constantly working with the healthcare authority as well, because they're the ones that get all the funding, and then they divvy it out to the MCOs and the ASOs throughout the state to utilize, and then set the requirements for how we use it. So we do have more programs, a lot more programs coming in, and more funding coming in. And so as we do so, we're looking at gaps, and we're looking specifically at shelters, especially the shelters that do behavioral health services. And again, our portion of the people that we can fund for those services is very small, because most people are on Medicaid, and that's a great thing. You know, they're going towards the Apple Health Solutions, which is what they should be doing. And so that's why we're always looking for, is there something that that Medicaid won't cover? And can we go in and look at that from a behavioral health standpoint with our funding? So we're always working at that and using that information. I just hope that's kind of helpful information, because a lot of people think, oh, there's no behavioral health services going on. There are lots and lots and lots of services going on, but part of the problem are the waiting lists, because in some cases because of the workforce shortage. So thank you.
Thank you.
Thank you so much, Kathleen. That was great information. So next up on the director's report is the Mayor's Advisory Council on the Downtown Environment. And we had some discussion about this at the executive meeting. And I'm not sure if anybody, well, I know some folks obviously are familiar with it, but essentially the Mayor's Council on the Downtown Environment is a group that has been put together that is comprised of business owners, some providers, and some city staff, some folks through the police department. It's a pretty wide-ranging group, and they have been reviewing. So like at the last meeting, there were slides that were presented from Governor Gregoire's plan that she's been putting out there, as well as the mayor really joining efforts to support the legislature on addressing homelessness and affordable housing. And I know that we discussed, and I apologize, at the executive committee a little bit more what you all wanted to hear about that. And Adrian, I know that you are familiar with the meeting as well. So I just wanted to see if you had any other feedback about the Mayor's Council.
I think we just wanted to share because so we started meeting in the middle of fall, and just sort of to acknowledge that this exists. And there are a large number of business owners, and as you mentioned, members of the police and the fire department, and members of different boards, and I'm there in part because of my relationship with the CHHS board. The vice chair of the COC board sits on this. Is it the Homeless Coalition? Barry is, no, what is it called? That Robert, where Robert is.
Oh, yeah, well, Robert works at the clinic downtown, but I suppose he's probably there as the chair of, chair of the homeless coalition.
Yeah. So the chair of the homeless coalition, and then some, and service providers like Family Promise and some others. And it's just, I think all that we wanted to share really, Jen, is just sort of acknowledging that because oftentimes it feels like there are layers and layers of different committees that are looking at similar things. So just sort of acknowledging that this group exists. The Governor Gregoire's gave a presentation from Challenge Seattle, which is what she's I think the CEO of right now, which is a group of businesses in Seattle that are coming together to address and respond to the homelessness situation from where they can with the advantages that private companies have. So it's largely been educational pieces and sharing information. There hasn't been, it really is an advisory council, so it's been more discussion based and those sorts of things. So it's not like there's policy coming out of there. I think we were just more interested in sharing it just because as we look at all these places where this kind of information is being shared, we want to just be as transparent as possible. That's another space where the CHHS board does have representation, and we are having some similar conversations just with some different stakeholders.
Thank you, Adrian. That was very helpful context. Does anybody have any questions about the Mayor's Advisory Council? No. Okay. So last is the CHHS Department newsletter and staff overview. As you know, we're actually down 3 staff in the last couple weeks. We are actively looking to fill some gaps, and we're making progress on that. So we are still very challenged in terms of staffing support for the programs that we currently have, along with the programs that we're hoping to implement. There are various funding sources that are out there that I think there is look toward the CHHS department to help with in terms of utilizing our experience and skills with RFPs and utilizing the CHHS committee as well. Some of the funds that are out there that are being discussed are the 1590 funds and the ARPA funds. And there's a wide variety of work groups who are all working on that. But some of those funds are looking as though they may end up flowing through our department at a certain point in time once those priorities have been identified. So really just working to make sure that we can both manage the existing work that we have without letting those items kind of languish and manage some of those new requests that are coming toward us. But I think overall we're making some really good progress. We have a couple staff who are fairly new, but they're really coming into about their 4th month, which I think is where you start to kind of get a handle on how things are running. So I'm very confident that we're going to be able to get fully staffed and really be operating on all cylinders, which will be great. And we will have a new new department newsletter coming out. It may be delayed a little bit. Our gentleman who's doing that had to be out, unfortunately. So you might not see that right away, but we expect to have one out here shortly. And we're usually doing that about every 2 weeks. Any questions?
Nope. So are we done with, looks like we're done with the director's report. Anything else before we move on to board education?
Nothing for me. Thank you. I appreciate this new format where we have the line items. It's helpful for me to make sure that I'm addressing all of the things. So that was really great today. Thanks.
Thank you. Thank you, Jen. Okay, board education, Adrian.
All right. So So I don't think I'm going to need 20 minutes since we already had some of the discussion of the continuum of care retreat that took place. And I don't know for sure that this is the newest version of what the plan is, but this is the draft that I got from Ben yesterday. So as I mentioned, the Continuum of Care Board is a regional board, and the regional board comes up with a 5-year plan to end homelessness, and I think year 3 I think is the year that we're at technically in this plan, but incumbent on the COC board, because of HUD, just as we have certain things we need to do, they have to revisit this plan every year and do this sort of annual review. And the desire this year was to do a very intentional deep dive and to try to get broader community buy-in. And by community buy-in, they mean the making sure that all of the boards were kind of on the same page. Make sure departments in the various the cities involved and the county were at least agreeing with certain directions, that their elected officials were also on board. So in an effort to try to bring all of that together, they held a retreat on February 14th that were about wide, as Jen mentioned, where a wide variety of people were brought in. And at that time, identified some areas that we wanted to dive a little bit deeper in, specifically to talk about gaps and those things so that we can help work towards a more holistic solution. I will say, for those of you who are newer on the CHHS board, a little bit of history that's important is right when Ann and I joined this board, was when the continuum of care function actually separated from this board. So originally what had happened and what formed the CHHS board was a desire to have all of the scope of both homelessness and things around low and middle low income needs to all be sort of addressed in one space. So that there could be folks who could offer recommendations that were sort of seeing this whole picture. And so that was the goal when the CHHS board was first put together. And then HUD rules changed such that COC needed to be regional, not city-based, and therefore couldn't be under the city. And so right as Ann and I joined, and Ann, please correct anything that I'm flubbing, but right as we were joining, that was when the process of the COC board being formed as per HUD rules. And the COC board, the intention always was then we would come back together, not as one board, but come back together and be in communication and make sure we were continuing with this holistic vision. And then, like so many other times when we say, and then COVID happened, and then COVID happened. So right as really COC got its feet underneath it, got established, all of those sorts of things, COVID hit, and we just didn't sort of get to that next step of making sure that we were very intentionally working together. So this has been our first opportunity to make sure that that the boards in the region are all working together towards the same goals. And that we're doing so very intentionally. So anyone who has anything to add who was at the retreat or with any history, please do. I'm going to share the, we'll see if it shares, but I'm going to share the draft of sort of the plan that we have going forward. I don't know what that looks like in your screen because my screen is now very different. Can people read that?
Yeah, I can make it larger, and I can read it when I enlarge it.
Yeah, I'm used to Zoom. I apologize. Let me see if I can make this.
Can anybody else not see it very well?
I can also put it in the chat.
I see it fine.
Okay. So, and I'll read through it and I'll share this, but so So again, there's a 5-year plan, which we can go find those documents. Those documents exist for the 5-year plan. And there was various programming, but the goal is that for the annual review to instead do a more robust planning process that has like a 2 and 6 month plan. This planning process does to try to really identify where there are gaps in the system and also come up with a holistic solution. So on February 14th, we had this larger meeting that was primarily different board members, different service providers, and electeds, and CHHS and NHHS staff. I think I'm getting all those initials right. And during that time, we identified, identified the areas that we were going to dive deeper into. And so there's this is again a draft plan. So the plan is that there's a fast track, which is how can we identify these gaps as quickly as possible. So there's an ask for boards to have members volunteer to participate on some specific working groups. And I'm going to bring up those working groups in a second. So in that first 2 months, there's pretty intensive request for activity and meeting and bringing of expertise to participate on this. And then in the next, I would say 3 months, there's a little bit more even paced thing where we sort of bring this plan to fruition. But again, the goal with this is to make sure that we're identifying those shared values, that shared vision, and a recognition of where are there gaps in this process so that we're bringing everybody in and participating. So that's really the goal. So hopefully it's scrolled and you can see some work groups. I'm gonna describe the work groups. I kind of tried to organize them based on what Ben gave me. That said, I'm thinking some of these work groups overlap. So what I would ask you to do is if you have an interest in a work group, that you let me know, and I will pass that on, and I'll let you know if it's combined with another. But the work groups so the areas that we wanted to dive deeper into were outreach, diversion and coordinated assessment. And as Jen mentioned, we had a really great presentation about what coordinated assessment looks like. There were areas in housing that were interesting that people were diving into. So permanent supportive housing, transitional housing, and housing for veterans. Again, please keep in mind that the Continuum of Care Board is primarily focused about people experiencing homelessness. So we want to make sure that our interests, concerns, input aligns, but recognize it is slightly out of our normal scope. But we just want to make sure that we're sort of having this collective effort working forward. Another area was shelters. With the things that rose up in shelters were things like singles and families, youths, seniors, as different shelter needs or areas of need. Equity was also in there. To what Kathleen talked about, integrated medical care is a piece. It was an important piece at the working group that people wanted to dive into, identifying those gaps, rapid rehousing, and then sort of the overall operational implementation of the plan. So the Continuum of Care Board is going to take the heavy lifting, and they're the ones that are going to be running these committees. But what they're hoping for is broad participation from service providers, elected officials, and board members of boards that are connected to this work, including our board. So the ask is for you to identify if there are areas that you're interested in contributing to, participating with, that you could provide feedback with in this process with the working groups. As I said, I put the commitment here. It's a big commitment at the start. The commitment at the start is that they are planning up to 6 meetings in March and April to really get a sense of where the issues are. That said, of course, not everybody in the working group is going to make every single meeting, right? So we recognize that, but the work is front loaded in March and April. And then the secondary part of the commitment would be to then, when we bring all of this feedback together and work together, are a few sporadic meetings May through August to help bring the plan together. And I would just say that this has been this process. So this process, first of all, is being supported by Empire Health Foundation. There is a facilitator consultant a professional facilitator consultant that's going to be brought in to do some of this work and to work with the working groups. So again, the bulk of the work is being done by the COC board, and then there's going to be this formal facilitation that's being done with Empire Health. So what they're really looking for are for people on the boards to be participating in these working groups and contributing and sharing both your experience, which is why you're on this board, but also making sure that we're having good open communication between all of the different boards that are involved in this system of areas for concern. So that was a lot. I think I did take all the time I needed. I'm trying to figure out how to stop sharing. I'll figure it out, I think, in a second. But I'm going to put the subcommittees in the chat when I can figure out how I can do that. But any questions?
I didn't have a question, but I did have a comment, which was if the Continuum of Care board during these retreats wanted more engagement with local elected officials, it would just be a really good idea maybe to not have that on Mondays, because I know that a lot more council members wanted to actually be present, but Mondays are the most difficult days because there are several council-wide committee meetings, briefing session, legislative sessions, etc.
Yeah, and I'm not sure. I'm not sure what the reasoning was for that date. To be fair, that's not, and I think that that's a good point. And I think I would hope that the plan for these working groups, that they will avoid some of those dates. So thanks, Nicolette. Yeah.
And I would just second that for the county commissioners as well too. I don't think any of them attended because of conflicts, and I think getting the schedule out well ahead of time, we can certainly pass this type of information over to the MCOs if you're not inviting the MCOs specifically, but medical integrations, you're not going to see anything move without having the 4 MCOs in our regions in attendance.
Kathleen, I'm gonna send you an email to follow up with you, because again, this is Ben Stuckert is the chair of the Continuum of Care, so I'm not organizing this, but if I'll follow up to get that information to make sure it gets to Ben. So
yeah, that sounds great.
Yeah.
And you can let him know that he can contact myself, and we can get him the contact names that we have for the MCOs. There's multiple contact names for everything, but there's usually 1 or 2 that are key. That we have a good relationship with. A lot of them are former employees. So we're able to at least get that information out. And if there's enough time, they may participate. They are, it's sometimes a mixed bag. We don't really know, especially when it's in the evenings, whether they're going to participate or not.
Yeah. Thank you so much.
Mm-hmm.
So my ask isn't that you don't necessarily have to volunteer now, although if there's a working group that you're interested in at least hearing when their dates are going to be and those sorts of things, please feel free in the chat or via email to let me know your interest level. I will pass on both the talk to Ben about hopefully when there's especially the full group meetings, that they will avoid Mondays in the future, and also pass on Kathleen's information.
And Ben should know better. He knows there are council meetings on Monday.
Yeah, he's been to a few.
Yeah, just a couple.
I think, yeah, it got, I think to grant grace, it was something that this retreat was planned earlier, and then there was the spike, and then the point in time count moved around, and various things happened. So I think to a certain extent, it was like, oh my gosh, this is the date that works. And I will say, for those who are curious, that it was unfortunate. I think that I think Zach was able to make it, but that was the only council member, and you know, of course, that's a gap. But both Mayor Woodward and the mayor of Spokane Valley were able to be in attendance as well. So there's at least some electeds and the intention of electeds participating. So I'll be sure to pass that on, though, Nicolette. Thanks.
Anything else for Adrian? Excellent initiative, a lot of work, great potential. All righty, shall we move on to city council update? Nicolette, I think you are it.
I guess so. Neither one of them are still here, so I'll go ahead and give you guys a few updates. Some of the things I can say is that, well, one of the things is that City Council just expanded the MTFE zones to include some areas of the Garland District to make way for more affordable housing. And Councilman Bingle is on the MTFE review committee, so I wouldn't be surprised if you see a lot more sort of positive changes coming down the pipeline with respect to that. I also think it's worth mentioning that Councilman Bingle gave testimony in front of the state legislature on SB 5853, which would allow the DOT to lease back some of the land that they used, basically thinking that they were going to use it for I-90 and the North Spokane corridor, where about 1,000 or more houses were demolished, and now you see that's just vacant land. And so SB 5853 would allow DOT to lease that back for use for things like affordable housing, which obviously is great, since that's what it used to be. And if they're not going to use it, it's good for it to be put back to that use. I think it's also worth mentioning.
Nicolette, can
Sorry?
I just pause for a second?
Sure.
That bill is being sponsored by Andy Billig, right?
Correct.
Yeah, and I know that it had to shift a little bit in who, but I just so folks know that Andy Billig supports it. A number of council members gave testimony, and mayor also gave testimony in favor. There's some shifting in how that land's going to be used, but that is something that's had actually quite bipartisan support in the city moving forward.
Yeah, and I think there's kind of an acknowledgement on everyone's part that certainly that the removal of all those houses contributed to the housing crisis we currently face. And so it's really important to be able to put that back to its original use as much as we can, that is. So, we're hopeful that that'll go all the way. I think it's also worth mentioning that Councilman Bingle has essentially committed the next year to just really investigating the sort of the intersection of the crisis with respect to homelessness and housing, and especially with addressing homelessness. And by doing so, we have already had dozens of meetings with various stakeholders, and plan to develop a kind of proposal or report. I don't know exactly what language you'd want to use, but sort of analysis of our findings and some suggestions moving forward. He certainly acknowledges that we need to get better about planning ahead in the future. Winter comes every year, and as I like to say, if we can get the Zambonis out on time, we can make sure that we're ready for the warming centers, every winter. And so part of that too, for Councilman Bingle, is acknowledging that it's not really possible to solve homelessness, full stop. It's always going to be something that our community faces. And so acknowledging that we're never going to completely end it, and making sure that all of our steps going forward are really just mitigating, some of the ways in which our community can suffer when those proper plans and actions aren't put into place. We've done things like a tour with Jules Helping Hands at their new facility. We've even done a ride-along tour with her. And that was actually really interesting, because there were areas of the city where people were experiencing homelessness that I didn't even realize they were there, and this is coming from somebody who 25 years ago, I was homeless here in the city of Spokane. And so I have a lot of lived experience in that, and Councilman Bingle and I are working together to make sure that we're really taking into account not just the stakeholders such as businesses and, certain kinds of community service providers, et cetera, but also with impacted individuals who've either experienced it in the past, are currently experiencing it, et cetera. One of the interesting tours that we took was with the Salvation Army, the Way Out Shelter, and they're doing a lot of great things there. Now, one of the main things that we saw being done there was can get everybody, ready to go and get them a new job and
Yeah.
get them ready for housing. But if there's no housing, there's nowhere for them to go. So that's really where you have to identify that, we have two different crises happening, a housing crisis with homelessness, and they're intersecting in a really interesting way. And so we're not going to just be able to talk about one topic. They're just going to have to go hand in hand. And if we don't get obviously more housing, if it's affordable or market rate housing, if we just don't get more housing at all, there's going to be nowhere for people to go, even when they've gone through the arduous process of either lifting themselves up out of the homelessness or going through some sort of program that assists them in doing so. So, one of the reasons why I do bring this up is we are open for meetings. We've met with a lot of different individuals. And if any of you guys are interested in meeting with us to let us know what work you're doing, that would help us, not only create a more informed analysis, but a better set of, again, I don't want to say solutions because it's not about being able to solve homelessness, but about a set of proposals and suggestions, what works, what doesn't work, what we can do going forward, and what kinds of things that we need to get better about planning every year, the things that are going to always come up that we need to be able to have a system in place to address. Are there any questions or anything?
I would just say, yeah, and we don't, similar to RFP, we don't have an affordable housing committee meeting we have it scheduled every month, but we only have it if we have something that comes up. But it would be great for you and or council member Bingle to come because one of the gaps that has happened is an understanding of this board as non-conflicted and available and able to respond to certain needs and help with creating our RFPs and then help evaluating those. And that's the same for the RFP committee and the Affordable Housing Committee. So we have a committee that exists that has folks from industry and various things, people with previous HUD experience and things like that. So it would be great if this is an interest of his for him to meet with that group at our next meeting or whenever we can work that out.
Yeah, absolutely. I'll be in touch with you about that. We even had a really enlightening conversation with former council president Ben Stuckert. And I think that really reaching out to people who are in, are different figureheads and have different past, because what's interesting about people that work for the city is once you start to work for the city, sometimes you never really leave. You just go into different roles and different positions. And there are a lot of people that we just really need to tap into their experience when they were in different departments or working in different roles. And we have all of this expertise out there. It's just a matter of tapping into it. So I love suggestions like that, and I'll definitely follow up with you about that.
Thank you, Nicolette. Anybody else? Anything else for Nicolette? Thank you. I'm heartened by Councilman Bingle's interest in that homelessness and housing. The agenda items remaining are Affordable Housing Committee, Evaluation RFP Committee, and announcements. And my clock says we got about 6 minutes for all that. So Affordable Housing Committee.
We had those action items, so that as far as I know, George, unless there's anything else that's on the horizon, that's the only update were those things that we needed to take action on.
Yeah, we'll likely have something next week or next month, but that's it for now.
Okay, good brief evaluation RFP. Jerry, anything?
Likewise, just membership, but then also, as you heard Jen say in the director's report, that they are getting additional funding, that 5.8 million, I believe. That RFP committee will be supporting that, so there'll be more of an update potentially next month on that.
Okay, thank you. And announcements, Catherine, I think you got enough time just to tell us what is coming. But I think at our executive committee, we're probably going to approve you giving a report on this. The report, I did put out an email so folks can read it. But Catherine, you want to speak to it for 5 minutes?
So a lot of things came up in the Housing Action Subcommittee and in the working groups that really apply to us. One was having being assured or somehow knowing, so maybe a report back, if somebody can tell me what's true, I can take that back, is whether the points that we use in our RFPs are actually supporting some of the things that Spokane wants to see happen, to make sure that we haven't changed or outgrown what we've been using, to make sure that we are getting the kinds of RFPs that we really want to have. There was also development of a housing racial equity impact assessment form, which is fairly lengthy actually, but it's a way of assessing whether the RFPs and the vendors we use are really addressing some of the racial inequities that we have. So I've been trying to get a copy of that to forward to you, and so far have not done it, but I will work on that and make sure that you see it. If we find it relevant, then it should probably be part of our RFP process also. So that would be something that we would look at and see if we want to do that. That is the intent, but we'll see if it works. And there was a real interest in creating a focused approach to gap funding. So I know we've talked about that. We all know about that. And this is as much for Eric probably as anybody else, to develop some sort of way that we're really looking at gap funding in a coherent and organized way, instead of just praying that we can find it when we need it, but really have somebody that's looking for it. And then let's see, begin to stack funding for the 1590 RFP process. There is that issue. It would be nice if we were strategizing around that. Whether we have planning tools for allocating money and funds, planning for developing regional collaboration. I think we're doing some of that, but it would be nice to kind of see a plan for that, so that we actually know what's happening and how people are interfacing. Are there ways, discussion, maybe plan to manage the length of the funding cycle, so that we're not being crazy about it, but actually can work with it as in a more strategic way. And then better use of the 2022 4.1 million and the annual 6 million worth of funds that we have. Are they being used to fill in? Is there a plan for it? Those were questions that the committee had. So that's a really quick overview of some of the things that really seem to impact us specifically.
All very important. Yeah. Well, okay, cool. Any questions for Catherine in the 2 minutes remaining?
And the reports, he sent it out, so.
Yeah, it was attached to the email I sent out. Housing Action Subcommittee, February 17th. Now, okay, any other announcements in the minute remaining? I'm being kind of strict on the time because I have something I have to go to, so I can't let it go past 6.
Yeah, I just put it in a chat. This is the third annual panel that GU School of Business holds on affordable housing. The first was before COVID, and the intention always was to not have this just be a panel of awareness, but rather actual community engagement and projects moving forward. And then COVID happened. So that's actually what this goal is, moving forward. So this particular panel has representation from the city with planning services, from builders, from service providers, and then Chris Patterson. Some people in the city have experience with him, but additionally, he's now working with Washington Trust Bank on an initiative called Hello for Good, which is an intentional initiative of how a bank and other private industry can help contribute to solutions around issues around homelessness in Spokane. So I will be sending more information out about this event as it gets closer, but I just wanted to give you a heads up since it's before our next meeting.
Do you know what time of day it is?
It's in the evening. It'll likely be 6 is usually when they start.
Okay, good. Yeah, send it out on email when you know more details, and then I'll help get it out as well to the Homeless Coalition. All right, I got 6 o'clock. Anything that needs to be said before we adjourn? Thank you all so much. We got a lot done. Thank you very much
Thank
for
you.
hanging in there. And bye.
Thanks, Anne.
Yeah, thank you,
We're gonna
Ann.
miss you.
Adios.
Thank you, Anne.
Hasta luego.
Yeah, see,
I
adios.
blame you. I blame you for getting me on here, Ann.
Bye-bye.
Bye-bye.